Greetings, ladies and gentlemen. Did you know that rare infections caused by unusual pathogenic bacteria can also cause life-threatening illnesses that often go unnoticed until the patients pass away? Among all Moraxella strains, Moraxella catarrhalis is the only known strains cause infectious diseases which has been explored until now, with the rest being human commensals. Until recently, there have been emerging reports of unusual life-threatening infections caused by non-catarrhalis Moraxella strains, particularly in immunocompromised patients with no clear treatment algorithm. Therefore, I am Annisa Salsabilla Nugrahani, made a systematic review research that will outline and systematically analyze the secondary data from previous case reports. This research aims to outline the association of non-catarrhalis Moraxella strains and human diseases, including their underlying medical condition, symptoms, treatment, and their outcome. This study design was chosen because it adheres to the PRISMA protocol and has the highest evidence hierarchy when compared to the other study designs. And the systematic review includes 11 Moraxella strains other than Catarrhalis, which are listed below. We searched for the relevant articles from the four highly recommended medical databases, including Medline, Web of Science, Embase, and Scopus. And following that, we include those who meet the inclusion and exclusion criteria, which we listed below as well. And from 13 and 68 articles, only 132 eligible and high quality case reports were included and explained in the PRISMA protocol here. And we decided to create a result table based on the included and included paper, which includes the study designs, the patient's age, their underlying medical conditions, symptoms, which strains and diseases are associated, the treatment given, and their outcome. And we also divided them into groups for similar strains, particularly those with a large number of articles. And we discovered that 3 of the 11 included strains have the majority of papers, so we grouped them and analyzed them further in another sheet. And this is the result table that I mentioned earlier as we scroll them. So the result is the among 11 strains included, Moraxella osloensis, Moraxella non-liquefaciens, and Moraxella lacunata are the 3 most commonly associated with human diseases. And from 132 articles, 47 reported Moraxella osloensis infections, 41 reported non-liquefaciens infections, and 28 reported lacunata infection, with the rest reported other strains. And from Moraxella osloensis articles, we discovered that 21% of them are linked to sepsis, while 13% of others are linked to meningitis. And we also find out that 29% of non-liquefacian articles are linked to pulmonary abscesses, and 25% others are of endophthalmitis. And we discovered that 25% of Moraxella lacunata articles are associated with endocarditis, while 21% are associated with conjunctivitis. Other strains have been linked to other infections, but with fewer reports. And we also discovered that immunocompromised patients, such as those with HIV, leukemia, untreated diabetes, and etc., are more likely to develop Moraxella infections. And since some strains are resistant to certain types of antibiotics, only a few algorithms could treat them. Thus, we believe that more research is required to evaluate the treatments needed to achieve a better outcome. And hopefully, this paper could guide healthcare professionals in treating non-catarrhalis Moraxella infections and serve as the starting point for future research. And last but not least, a disease may be rare, but the hope should not be. That's all from me. Thank you, Nafas.